Hello, welcome to another Tuesday tip. This week I'd like to tell you about a study that was published in the September-October 2020 issue of the Journal of Pediatric Dentistry. It was entitled Clinical Comparison of 3 Aesthetic Full Coverage Restorations in Primary Maxillary Incisors at 12 months. It was conducted by Gil, Garcia, and others at the University of Washington in Seattle. The purpose of the study was to compare 12-month clinical outcomes of primary incisors that were restored with either composite strip crowns, NuSmile Pre-Veneered crowns, or NuSmile Zirconia crowns. 47 children and a total of 135 incisors were included in this study. In addition to other treatment, every child required at least 1 anterior crown and all were treated under general anesthesia. All of the incisors in each child were restored by the same type of crown, which was randomly assigned to that child. 4 pediatric dentists were calibrated on tooth preparation and crown placement using either typodonts, extracted teeth, or training cases completed under general anesthesia. All of the procedures were completed under rubber dam isolation. Now, the strip crowns were prepared in a traditional fashion. The appropriate shades were chosen prior to filling the crown form, and all the teeth were etched for 15 seconds, bonded, and placed using Filtek Supreme composite by 3M. The preparations for the pre-veneered and the zirconia crowns were very similar to one another. The pre-veneered crowns were fit and cemented with Ketac, a glass ionomer cement, while the zirconia crowns were cemented with Biosim, a resin-modified glass ionomer cement. Now, clinical assessments were done at 3, 6, and 12 months. All the crowns were assessed for fit, for color match, retention, the integrity of the facing, marginal adaptation, and gingival health. Parental satisfaction was also inquired about. Here's what they found. There were 47 teeth with pre-veneered crowns, 40 teeth with zirconia crowns, and 48 teeth with composite strip crowns. Most of the children who participated were covered by Medicaid, 55% were female, and 45% were male. They found that there were significant differences between crown types for color match, for crown retention, integrity of the facing, and marginal adaptation. For all of these parameters, strip crowns showed the lowest clinical success. At baseline, all the crowns had good and acceptable color match, but at 12 months, the pre-veneered and the zirconia crowns maintained their color match, while less than 1/2 of the strip crowns had acceptable color match. Retention of the strip crowns was also significantly worse than the retention of the pre-veneered and zirconia crowns. Nearly 100% of the veneered and zirconia crowns were retained, while only 79% of the composite strip crowns were retained. Additionally, the strip crowns had significantly more marginal discrepancies at 12 months. Most of the parents were satisfied with the overall appearance of the crowns, but the ones who were dissatisfied were mostly dissatisfied with the color of the strip crowns at 12 months. It's interesting to me that color was one of the areas of dissatisfaction, because the shade can be selected for strip crowns, while the other 2 crowns only come in 2 shades, light and extra light. The fact that the integrity of the facings were significantly better for zirconia and pre-veneered crowns and worse for strip crowns indicates that there seems to be an issue with the durability of strip crowns. So, what did the researchers conclude? First, all of the crowns were clinically acceptable after 12 months. Second, zirconia and pre-veneered crowns had better color match, better retention, better facial integrity, and better marginal adaptation than composite strip crowns at 12 months. And third, parental satisfaction with all the crowns was high, but after 12 months it decreased for strip crowns due to the color changes of the material. So we all know that strip crowns can be beautiful, and we have a choice of shades prior to placing them. So it's easy to match the adjacent teeth. However, this study, as well as some others, have found that the durability of strip crowns and the color stability should cause the clinician to give consideration to the alternatives of pre-veneered and zirconia crowns. You know, if any of you would like more training on placing zirconia crowns, you should check out NuSmile's online Progressive Aesthetics course. Hey, thanks again for listening to this Tuesday tip. I hope you have a great week.